Uganda. Dr. Frank already mentioned that in December 2023, we did the maiden transplant successfully. We were all very nervous, but when we were all successful, we really jubilated and we shared the news with you. And thank you, the media, for always coming to share such news. Now, it took us almost another year, but in November 2024, we did 4 transplants, and again we called you. And in that media briefing, we promised that this coming financial year, we plan to deliver at least 12 kidney transplants. And now we have started. And we started early in the year, so I'm very optimistic that we will make the target of 12 in this financial year. I'm happy to announce that this was successful because of our collaborators, Kidney Care for All, which is a non-profit organization based in UK. Remember, all along, we've worked along with our collaborators from India, the Yashoda hospitals, who held our hand to guide us in even how to design the transplant unit. Our teams went for training with us. And now we have another set of collaborators because Yashoda cannot come as frequently. And it's also good to have several, to have you here as one of our collaborators. And you know how we do it when this team was introduced to us by Minister of Health. So we are very grateful to the Minister of Health. And then we had to send our teams visit in UK and see how they work. And that helps us to know how to prepare for these teams to come and work with us. So we are also grateful to the government of Uganda because all this wouldn't be possible without resources, which money is appropriated to us as an institution. So we are grateful to the Ministry of Health for the guidance, and even the collaborators you bring to us, and also the government of Uganda for the resources. We are really very grateful that this team from Kidney Care for All came because they spare their time. I'm sure they also pick from their pocket, although we do the minimum of an air ticket and accommodation within Uganda, and also giving them our African Ugandan food, which I'm sure they have enjoyed. Yes, but the skills transfer is amazing, and the team has been really full of praise on the way you worked with them and imparted skills on them. It is amazing, and we are really very grateful. I'll also not go into details of the local team or the teams, the multidisciplinary team, which is required because Frank tried and left out some. So you see, it takes a lot of people within the hospital to put this together. You'll forget and think you have an anesthesiologist to put the patient to sleep. The nephrologists have prepared the patient and the surgeon is ready until the water fails. Then you remember you need a plumber. Support services. I can't thank you enough because you are the forgotten heroes. And we remember you when things go wrong. Thank you very much. Or when the meals delay because support services was not involved in time. And the surgeon cannot scrub and stand for hours without having a meal. The surgeon will collapse on the patient. So thank you very much, support services. Now, following these successful procedures, which they've enumerated to you, our patients continue on their road to recovery. They still need the support of us as the hospital. They need support from family and friends. And I want to call upon the family and friends to give the necessary support. One, we are not telling you to support by visiting them, because we still want these patients isolated so that we prevent them from getting any infection while in the road to recovery. They still need to be on medication, so they need resources. And soon, when they are well enough, at least they will start working and they can generate their own income. But many of them, and one of them who is even a teenager, I'm sure is depending on relatives and friends. Why I'm emphasizing this, you know, in our African culture, we know a patient, we should go and visit a patient. We restrict visiting close contact with these patients because they can easily pick infection, and that would affect their recovery. And on that note, I want to talk about another innovation which we are bringing on board as Mulago NR Hospital. That is the one patient, one attendant policy. One patient, one attendant policy. This measure is not intended to inconvenience families. It is intended to help the patients heal. I've had my own experience nursing my dad, and we're in a room with two patients. The other, me being the medical background, I was strict on my family, and we made a timetable. One person there, at most two when we needed to turn the patient with assistance from the nurse. But the other family was full board. So we felt a little bit inconvenienced. But this is what happens even on our wards. When you have a patient, they are supposed to be in a quieter environment, allow the medical people to work on them, and also, you know, and sometimes it becomes a little hard. But with this introduction of the one patient, one attendance policy, we doing it with the aim of decongesting the wards, to enhance the patient's privacy, which is that is being implemented. We welcome feedback so that we can improve on how we are implementing this. The nursing team, the doctors, the medical team are there to listen to your comments on this, and for patients who may require more than one attendant, we also can discuss and we can see where we need to increase the number of attendants. So we call upon all the public to cooperate. The attendant cards will be issued at various points, the specialized services. I want to thank our partners, Kidney Cares for All, for having spare time to come and work with us. I want to thank Ministry of Health for unwavering support to us that makes us shine. We are shining. Say all this for God and my country.
Discriminatory and to commit it to offend. Good morning, all. To celebrate yet another milestone that we've achieved as a country, and we are very delighted that we are joining in the team at Mulago to celebrate this milestone. Having operated 9 people with kidney replacement or kidney transplant is no easy feat, and as a country we have come very far. And I believe, and I want to re-echo the words that Dr. Frank Asime has said, that we now are good to go as a country. Looking back at where we started, when we were being oriented, up until where we are now, that we are able to take lead in conducting these surgeries is very big, a success that we should all celebrate, and we should be proud about. I think it's important that we clap to this. As a government, we have been referring people out this country for kidney transplants. Out of 10 people that we refer